What happens if an ER patient refuses doctors of a specific race? If the patient has capacity and refuses treatment from the available clinicians, then such a refusal must be respected. But clinicians must carefully document such a refusal to confirm that the patient truly understands the risks, benefits, and alternatives to his or her request. ER will need to make decision based on patient's mental competence and impact of delaying service. If emergency is not dire, the patient will be rudely told that they will need to wait until doctor of preferred race is available. Doctors of preferred race currently scheduled to assist other patients won't be rescheduled. Security personnel will be told to keep an eye on the patient. If patient asks how long the delay will be, they'll be told that that question is impossible to answer. If emergency needs immediate action, doctor of preferred race will be assigned if available. If not, ER will assess patient's competency of making decisions about their health. If patient is delirious, request will be disregarded. If patient seems to be competent, there is a good chance that will delay treatment until doctor of preferred race is available or patient state deteriorates to the point where they are delirious. If a patient is refusing treatment, medical staff will generally respect that, although they might want to make sure that the patient is lucid and understands the choice that they are making. That could mean a long wait, or inability to provide care, which could be risky for the patient. If the patient is unconscious, then the law usually gives some more leeway to err on the side of saving the patient's life, since an unconscious person isn't available to answer questions. If a patient refuses treatment while conscious, then falls unconscious, generally they will still try to keep you alive if they can. That's when Dr. Bailey sews up his swastika all wrong on purpose. Thumbs up. According to the video that ran every 20 minutes at the I brought my wife to last month, they can kick you out and refuse you future services to any of their facilities. I actually read a story about a racist white guy who died because he wouldn't let a black emergency room doctor treat him. In the near me, that would get you a whole bunch of STFU. You get who you get. I'd love to see a patient tell our tiny Latina doctor that they want someone else. She has personally, physically, all 4 feet 9 inches of her, thrown people out of the ER. I had a stay in the hospital and they had me fill out a document, part of which was asking if I was okay with blood from races other than my own being used on a transfusion. I asked the nurse if people were really that racist that they'd refuse a possible life-saving transfusion, and she said it happens a depressing amount of the time. A busy hospital on the city is gonna let you die or wait for you to dismiss your request. Doctors, nurses do have the right to refuse to help a particular patient if need be. Generally it has to be like severe reasons of safety. I know the will do their best to accommodate, but I feel this should be a FAFO thing where denial of care for being a schmuck should apply. Thin the herd a bit, preventing such stupidity from further propagating. Welcome to America. I once saw to a woman who screamed for a different nurse because the one assigned to her wasn't qualified to draw blood. When my associate and I approached her and asked why, boy howdy did she spew racist vomit filth at the pair of us. Grey's Anatomy has nothing whatsoever to do with medicine, ethics, or good sense. If someone refused a doctor because of their race, I suspect they'd get the next doctor, but on as low a priority as is ethical. You always have a right to refuse someone's service. You are the customer. However pedantic that sounds for an but it's true. My mom works in labor and delivery. Occasionally people will refuse to be treated by a male doctor. They will be accommodated if possible, but if it's an emergent situation and that's the only on-call, oh, you get what you get. If they have the cognitive capacity to refuse, we cannot force the treatment. We document the refusal and either make them wait until someone of their preferred race or gender is available, or we discharge them. Anyone ever see that episode of MASH? Dude didn't want a blood transfusion from a black donor. Docs put bronzer or something on his face while he under anesthesia to darken his skin. Hilarious. A patient refused to see me because I am a woman. He said he didn't trust female doctors. So my male colleagues saw him. He was having significant shortness of breath, so we couldn't really make him wait long. But if he was stable, he would have waited. That's how we usually do it. They'll see their preferred race or sex eventually. It's unfortunate. You'd think they'd be grateful to receive medical care. Physician here. They are free to walk out the door anytime they like. I am a big believer in free will. Interesting question, since we only have one drive in our at a time. It would probably go under leaving AMA if they are not stabilized, and they would have to drive 20 minutes to a different hospital.
If you enjoyed this video, please check out our playlists full of similar content. Epicaricast is like doom scrolling for your ears. Please like, share, and subscribe.